Hello, my name is Pedro. I'm working in a hospital as a healthcare assistant, and I just want to tell you what is a shift look like during one of my normal days in a hospital. Well, if you see, my eyes is quite red, so I have some surgery last Monday, so don't get scared. I'm not a vampire or something like that. Yeah? Well, in a hospital, you come in the morning. We do the handover with the nurses. We see how the patient the need that they will need through the day. So we have a piece of paper with the main need that the patient need. Maybe they will need washing, they will need feeding, they will need we have to take the observation. So, and then when we finish the handover, we start helping the patient making the beds. If they need a shower, we ask them, and we go with the patient to the shower. In case they need our help, as well, we usually take their observation. I mean, with that, the blood pressure, respiration, heart rate.
So what kinds of decisions do you make? What sort of things will make you decide to maybe call for assistance?
Yeah,
or...
for example, if you see a patient, you take in the blood pressure of a patient and you see the blood pressure, because you must know the normal range before, of course, if you have healthcare assistant, you must know the normal range, which the blood pressure you see is below, for example, below 80 or something like this, then you see, and the heart rate of the patient is going up, is something wrong is happening. So you must go and call the nurse and say, look, this patient, that is what is happening to the patient. I'm not happy with this. So the nurse will come, and then will assess the patient and see what is going on, and then yeah. And as well, I don't know, if you see the patient, you want to talk to the patient, and you see the patient not talking, and it's not talking to you, or of course, or it's not breathing. Imagine you really need to call the nurse and just press the emergency button, because something very wrong is happening. But these things don't happen quite often, so don't worry about this.
Okay.
Yeah.
So Pedro, what do you like most about the job?
About the job. Well, that you learn a lot with the patient, you interact with them, you communicate. They telling you, yeah, they talking about their history on life. Sometimes that you learn a lot with them. As a healthcare assistant, we're lucky because we're more close to the patient than the nurses, because the nurses are quite more busy doing the medication. They have lot of work to do, writing, but we don't have all these kind of duties, so we're more close to the patient. We can sit down with them, we have time to talk to them. You feel like you done something really good, really great. So when I leave the hospital, I feel a kind of full feeling of before I used to do a different job. I wasn't happy at the end of my shift, but now I just feel great.